Hey, boss. So I talked to Mrs. Johnson. We don't have to be there till 10, so you have time to buy me breakfast.
Great.
Hey guys, you ready to order? You need a few minutes.
Yeah, I am, but give us a couple minutes so he can
Take
too.
your time. I'll be back.
Thank you.
Did you get that new ladder yesterday?
Yeah, I did, but why do you have that?
I found out I have diabetes.
Oh, man. You know, my mom has that, but she's not very good at checking her blood sugar. How did you find out?
Actually, it was kind of odd. I was at the dentist.
The dentist?
Yeah.
I would highly suggest Toyota, though.
Well, good. I mean, I'm ready.
Yeah, don't go with any other brand.
Okay.
I mean, you could, but it wouldn't be that great.
Sounds like a pretty honest place.
Yeah, they are. Great place to go. I've been going there for years.
Awesome.
Definitely the best.
That's what I'm looking for.
Yeah, phenomenal service.
Mr. Montgomery, how are you?
Hey, I'm good. How about you?
I'm good. I'm great. You ready to come on back?
Sure.
We'll get you started so we can get you back to work.
All right, Paula. Thanks for the tips on where your husband got his truck at.
You're welcome. It was nice talking to you.
You too. I'll check it out.
All right. Now go get your teeth cleaned.
All right.
So your blood pressure was a little high.
I've gained a little weight recently. That's probably it.
Okay. Well, let's start with an update on your medical history. When was the last time you saw your physician?
I think about 2 years ago.
Wow, that's quite a while. And from what I can see here, it's been over a year since we last saw you. Are you taking any medication?
No meds.
No? Nothing over the counter or any herbal medication?
Well, I take a multivitamin and occasionally an Advil or Tylenol for my joints. I mean, roofing all day really puts a lot of pressure on them. And I haven't exactly, lost weight recently. These extra pounds are starting to wear on me.
So what are you doing to take care of yourself? Are you working out?
I wished. I don't have much free time these days. When I get home from work, I just sit on the couch to relax and then watch TV and head to bed.
Well, as we get older, it does get harder to keep the pounds off. Let me just jot down a few notes and then we'll get started. Well, after examining your gums, I noticed they were bleeding and a little swollen. Have you noticed anything different since the last time we saw you?
Well, every time I brush my teeth, I spit out a little blood. And it used to be that it happened just once in a while, but now it's more like every time.
So you are noticing that it's happening more frequently than usual?
Uh-huh.
That concerns me. I think I'll mention it to Dr. Douglas before he comes in to see you. Are you ready to see Mr. Montgomery?
Oh, yeah. How is Carter doing? You know, he put the best new roof on my wife's boss's house.
Mr. Montgomery actually missed his visit with us last year, so it's been a while since we've seen him. His medical history hasn't changed. It's been almost 2 years, though, since his last medical exam with his physician. So he's complaining of being tired. He attributes that to work, though, and the additional weight that he's gained. His biggest concern is periodontal health, and bleeding when he brushes. So after examining him, I noticed that there's several areas of inflammation, bleeding when probing, and also loss of attachment since his last visit.
Interesting. Okay, let me examine him and we'll review the radiographs for further sign of bone loss.
Okay.
You were right, Sarah. He definitely has signs of periodontitis.
I wonder if there's something else going on with that. I mean, with the weight gain. You know, I think his mom and his sister both have diabetes.
You may be onto something there. The fact that he hasn't seen his physician in 2 years is a little disconcerting. We should advise him to make a follow-up appointment with his physician.
Should we also run a blood glucose test while he's here?
I was thinking the same thing.
I'll take care of that. Dr. Douglas, Mr. Montgomery's glucose level is 300 and it's been 2 hours since his last meal.
That's quite high. I'll speak with Carter about our concerns and contact Dr. Jacobs as soon as I can.
Okay.
Dr. Jacobs' office, this is Jennifer.
Oh, hi, Jennifer. This is Mike Douglas at Healthy Smiles.
Hi, Dr. Douglas.
I have a patient of yours in my office, Mr. Carter Montgomery. He says he hasn't seen you in 2 years.
Okay.
Please tell Joseph that we found evidence of severe periodontitis and decided to take a blood glucose test. It read over 300, so I felt Dr. Jacob should follow up with Carter for further definitive diabetes glucose testing.
Sure, I'll note that on his chart for Dr. Jacobs to be aware of.
I talked with Carter about my suspicions and encouraged him to see Dr. Jacobs. Also, please note that we're now treating Carter's periodontitis.
Yeah, sure. I'll definitely note that on his chart. I know that there's a definite link between diabetes and periodontal disease, so I will make sure that Dr. Jacobs follows up on that, and he'll give you a call.
Oh, that's great. And by the way, thanks for the heads up on Mrs. Monroe. With her Alzheimer's, she's really forgetful and has never told us that she's anemic.
Oh, yeah. Her daughter lets us know everything that she's doing and told us that she was coming in to get a tooth pulled. Okay, so we'll be sure to get Carter taken care of. Thank you so much.
All right, bye.
Bye.
Jeez, my dentist barely asked me how my day is going. Sounds like your doctor and dentist talk a lot.
I guess. Yeah, I mean, it's kind of like they should. They're in the same town. They probably play golf at the same place.
So your doctor checked you for diabetes and then told you?
Well, actually,
Oh, and you talked to Dr. Douglas at Healthy Smiles about being screened for diabetes, correct?
yeah. And my hygienist said that there might be a connection between my bleeding gums and diabetes.
Okay. Can you tell me about how much you exercise every week and then also about your eating habits?
As boss, I don't get much exercise on the job. I do work with the guys once in a while, but I don't have any formal program like going to the gym.
What about eating habits?
I just get whatever fits in the glove box in my truck, or I can grab at the drive-thru. I don't have time to stop, much less make something.
And any history of diabetes in your family, close relatives?
Yeah. My mom and my sister.
Okay.
So your mom and sis have it?
Yeah, they do. She said that was an important thing to know.
Man, sounds like that nurse asked a lot of questions.
Yeah, she's good. She also told me that there might be a connection between my bleeding gums and diabetes. Then she took my blood test for me.
Dr. Jacobs?
Yes.
Carter Montgomery is ready for you in 3.
Okay, I've got time now. When was his last visit with us?
3 years ago.
Huh. Anything new with him?
Yes, actually, I spoke with Dr. Douglas on the phone earlier this week.
Yes, Mike, what did he say?
He wanted us to know that they are treating Carter for periodontitis. He wanted to make sure that we knew that. Also, they did a blood glucose test and it ran over 300, which is why they sent him to us. They want us to do definitive testing.
Now, does he have a family history of diabetes?
His mother and his sister both.
All right. Okay, I'll talk to him about all that. Thanks.
Okay, sure.
You say he's in room 3?
Yes, sir.
Thank you. You know, Jennifer, that was a really great pickup on Carter.
Thank you.
Listen, we need to send some labs off, okay? So let's check a fasting blood sugar, a hemoglobin A1C, a creatinine, and a urinalysis, okay? And listen, we also need to make sure he's got close follow-up with his dentist so that he can maintain optimal oral hygiene. We don't want him losing any teeth.
Sure.
All right?
Okay, I'll fax him your notes from today.
You know, better yet, let's get Mike on the phone.
Okay.
Maybe I can talk to him about the patient and catch him in between patients.
Sure.
Okay?
Okay.
Thanks.
Turns out I have type 2 diabetes.
And you're so lucky to catch it early.
Yeah, I'm not sure I would have if it weren't for my doc and dentist looking out for me. My doc said I need to, exercise, lose some weight, lay off the carbs and sugars, and I can just take medication to control it. And maybe I won't get complications.
Man, you know how that would have gone down if that had been my doctor and dentist?
Doctor, Mr. Delgado is in exam room 2. He's been in there for like 30 minutes and he's spitting blood when he brushes his teeth.
Well, if he has dental insurance, I recommend he see his dentist. Isn't that what they get paid to do?
Seriously, Manny, you mean to tell me you don't think that your doctor would catch something like diabetes?
Well, I know for a fact that my dentist wouldn't call my doctor, even if I dropped dead in the chair.
All right, done checking in. Let's get started here. Open wide. Yeah, Ryder. Okay. So, did you catch the football game last night? Yeah? What do you think of that new player? I didn't like him so much. He wasn't really that good. Do you have any nephews? I brought my nephew to the game last night. He didn't really like it. What do you think about that? I mean, boys are supposed to like football. I don't know. Oh, ew, you're bleeding. Oh, shut your lips. All yours and two, Doc.
Is it Delgado?
Yes. Is he okay?
He's all right. The infection spread too far, though. We had to take his leg. I'm sorry.
I'm sorry.
Hey, Manny. You okay?
Hey guys, you ready to order? You need a few minutes.
Yeah, but give us a minute or two so we can both order.
Okay, I'll be back. Take your time.
No, I'm not okay. I miss being up there with you and the guys. I never would have thought that I would miss 100-degree days on top of that tar paper.
But you're doing great in sales.
It's just not me, man. I don't have the gift for gab, but I appreciate you letting me stay on doing sales.
Of course. Man, you really need to come to our office. I'm sure they're taking new patients.
Yeah, because I don't want a sales job with you. You give me to your office, and I'll take care of this.
All right.